you vaccinated the people who were not at risk from COVID, because they were people whose immune system could handle it just fine. And then you harmed them, and you also harmed the grandparents and killed them.
Hej och välkomna till Folkets Radio. Welcome to the People's Radio. Today with independent researcher and data analyst Sally Clark. Welcome.
Thank you. I'm very pleased to be here today.
It's great to have you. You are an Australian living in the Philippines, and you have collected data over birth rate, death rate, and several severe diagnoses. And you have seen a disturbing pattern that some increases coincide with the rollout of the COVID-19 vaccines. So we're going to talk about your research. But firstly, maybe if you could introduce yourself a bit more, about your background and how you arrived at this topic.
Okay, so I'm Australian. As said, I lived in the Philippines for nearly 30 years. My background is medical science and occupational therapy, so I have a strong medical background, but I've been working in engineering management and engineering consultant for the last 30 years. So this put me in a position where I have a very intense interest in what's happening with the population and population health. And I also have an interest in data and how to analyze what's been happening. So that's my background. And when I was in the Philippines during the pandemic, we were locked down. So we weren't allowed to go to work. We had to stay in our house, and the lockdowns in the Philippines lasted for 3 years. And during that time, I had a lot of time to research. So I started to look at what is happening everywhere. Are people getting better when the vaccines are introduced? Is there any changes? And I started noticing some very disturbing patterns. And the patterns that I saw triggered me to do more research. And I started looking at vital statistics. By vital statistics, we mean births and deaths, because these are the ultimate outcomes in any population. You cannot hide a birth you can hide a birth or a death, but it's still the ultimate indicator of what's going on in a population. So I've been monitoring the outcomes first in the Philippines and my home country, Australia, and then I've also been looking at other countries in Asia to see what has happened to their populations during the pandemic and then after the vaccines were rolled out. And in some countries, we no longer have vaccines. So the Philippines doesn't have COVID vaccines anymore. So we can also see what's happened since then.
Mm-hmm. So just tell us a little bit what it was like, life was like in the Philippines during the pandemic.
I will never forget that we were watching. So obviously we'd heard on the news that there was some new virus in China, and that was in February. And then all of a sudden there was a lot of media surrounding explosion of infection. And next thing we knew, the government here declared lockdown in the Philippines. So that was on the 15th of March, 2020. And at the time of the lockdown, only essential workers were allowed out of their homes. I was not an essential worker, and so we had to stay in our apartment. We weren't even allowed to bring our dogs downstairs to go to the toilet. We had to plead with our body corporate to allow us to take our dogs down. And finally, they agreed, and they said, you can go down for 10 minutes twice a day and don't talk to anyone. So this is I live in a private village, but this was the decision within the private village. So people weren't allowed to take public transport. We were given a QR code, an ID, and one person from any family could go out once a week to buy essentials. So you were allowed to the grocery once a week. At the grocery, we had to wear masks. We also had to wear face shields, and they would only allow 20 people into the grocery at a time. So we had to line up in the car park waiting to be allowed into the grocery store. So this went on for most of 2020 and into early 2021. And at the same time, there was 24/7 announcement of how many people had COVID, how many people had died, bad news continuously, which in retrospect, we know that was a psychological operation to make the population ready to accept the COVID vaccines when they came out.
Hmm. And what about when the vaccines were rolled out? Were there did you have vaccine passports or mandatory vaccines?
Yes. So vaccination rolled out in the Philippines on the 1st of March, 2021. Similar to other countries, they started off injecting the old people who were sick, and the frontline healthcare workers. Vaccination was not supposed to be mandatory. So they said in the bill that announced vaccination, it said that vaccination should not be a requirement for school, work, or government transactions. However, effectively, you had to show a vaccine card to do nearly anything. You weren't allowed on public transport. If a woman was having a baby, she had to show a vaccine card or else be tested multiple times for COVID before she could go to the hospital. Children in schools were not forced to be vaccinated, but they didn't go to school. School was stopped from March 2020 up until the end of 2022. There was no face-to-face school. The children had to just attend classes via a computer screen, and many children missed out on education during that time. So it was, the Philippines had one of the longest lockdowns in the world.
Hmm. Could you perhaps play a short clip of the president when he encouraged people to take?
Mamili kayo. Magpabakuna kayo o ipakulong ko kayo sa silda.
This is the president of the Philippines, Rodrigo Duterte. He is currently in The Hague being investigated for war crimes.
Is to have a tally of the people who refuse to be vaccinated.
What is happening here is that the barangay officials, these are going to a market, and they're going to check everyone's vaccination cards. And if people don't have a vaccination card, they're going to be fined or sent home or penalized.
So, but he's not going to The Hague for crimes against humanity and giving lethal vaccines. It's something else, I guess.
No, this is regarding prior to COVID. During his presidency, he had a war on drugs, and his war on drugs involved killing many people. They had squads that went and targeted drug users or suspected drug users.
So when did you first realize that there was something wrong with these vaccines?
My personal experience with medical background, I became skeptical of medicine when I was doing my thesis as occupational therapy. And my thesis was to do with back pain. And what I discovered during my research was that the number of doctors in any place is proportional to the number of patients needing surgery. So surgeons determine how many people have surgery, not the size of the population. So at that time, I came to understand that the medical industry makes its own business. So that many years ago was my first introduction to become skeptical about the medical system. And then I personally was vaccine injured from vaccination required for my course. And at that time, I understood that vaccines were not all benefit and no risk. At the time, then I had my own children, and my siblings had children, and we also had experience with adverse reactions among our children from infant vaccines. So I came into COVID already very skeptical. And then, of course, being at home, I had plenty of time to research. And the first doctor I listened to was Dr. Sherry Tenpenny. And she put out an article very early in the pandemic talking about the potential harms of COVID-19 vaccines. So after that, I watched multiple countries during COVID. I was monitoring how many cases of COVID they had every day. And my personal prediction was that once the vaccines roll out, COVID cases and deaths will increase. And I saw that happening in every country. The rollout in the UK was followed by a big spike in deaths. The rollout in the Philippines was followed by a big spike in deaths. In every country, they blamed COVID. But when you understand COVID as it's a flu-like illness, and it follows a pattern, you get sick, and then you should recover after a few days. But the people who don't recover, who get very sick, it would take maybe 2 weeks, 3 weeks for them to become critically ill. But what I saw was the vaccine rolled out and people died from COVID almost straight away. And that doesn't make sense from a medical perspective. So I personally suspected that the deaths that were being blamed on COVID could very well have been vaccine deaths rather than COVID infection deaths. So I was skeptical from day zero.
It reminds me of an interview I did a couple of years ago with a Swedish ambulance nurse who said that, whenever they got an alarm that there was like a COVID outbreak in an elderly home, she would think, but wait a minute, didn't they just have a booster? So she saw a pattern that when they got the boosters, then they had these spikes of COVID deaths. And yeah.
I was also aware from my previous work experience that for elderly people in nursing homes, they usually have scheduled vaccination for flu vaccines, for pneumonia vaccines, for shingles. And a lot of nurses know that after the senior citizens are vaccinated, some of them will become desperately ill and some of them will die. And I even heard someone say that vaccination week is come to Jesus week for her residents.
Okay. So, Sally, tell us about your research. What are the most, and feel free to share with us slides and graphics. What are the most disturbing patterns that you found?
The most disturbing patterns that I've seen are the changes in deaths and the changes in births following the rollout of the COVID vaccines. So the spikes in deaths happened in middle socioeconomic countries, for example, the Philippines, Malaysia. I've looked at Jamaica as well. Excess deaths happened immediate with the rollout of COVID-19 vaccines. In the higher socioeconomic countries like Australia, Singapore, Hong Kong, Taiwan, I didn't see a big spike in deaths with the primary series vaccine rollout. We saw a small rise in deaths, but not much. But I saw a very big rise in deaths once they started rolling out third, fourth, and subsequent doses. So I can see a different pattern of deaths in different countries. And the drop in births happened about in 2022 in most countries. In most countries, I didn't see a drop in births significantly in 2021. And the very interesting finding is that in many countries, in 2020, when we were supposed to be in the middle of a pandemic, there was no excess deaths. Deaths in 2020 went down in many countries. So that was very shocking to me when, we were being told 24/7 that there's so many people dying. But when I looked at the actual numbers, no, they weren't. They weren't dying. There was nothing unusual happening during the first year of the pandemic in most countries. Of course, the UK is different. We know they had their midolizam. They had the COVID protocols that killed people. But in countries that didn't have access to intensive COVID protocols, there was no excess deaths. So that would be my biggest, the biggest finding that I've had.
So when you talk about protocols, you mean like, for instance, that elderly people who got maybe pneumonia or something, they were told to stay at home, they were put on, hospice care.
Yeah, hospice care. They were put, an elderly person with pneumonia, they gave them sedatives and they gave them painkillers to immobilize them, withdrew appropriate nutrition and didn't give them antibiotics. So that is a recipe for death in an elderly person. So the failure to follow prior standard protocols of healthcare, such as if you have a viral infection in someone who's vulnerable, you can expect a secondary bacterial infection could well come along and be very serious. So the standard protocol in the past is an elderly person has a viral infection, you would watch them closely, ensure hydration, ensure they're moving so that they can cough, and then provide them with antibiotics if there was any sign of secondary infection. But in COVID, the opposite was true. Stay at home until you can't breathe. Come to the hospital, we'll give you remdesivir, and we'll put you on a ventilator. So, you know, there's case studies now, nearly everybody who was put on ventilators died because high pressure ventilation is not an appropriate way to manage a viral illness.
Well, in Sweden also, in many cases, they did not even bring them to the hospital at all. They said, there's nothing we can do, you have COVID-19. So basically that was a foregone conclusion that these elderly people would die. So you also looked at miscarriages and stillborn babies and fetal mortality. Can you talk about that?
Yes, so the countries that I've looked at in a lot of detail for infant deaths has been the Philippines. And in the Philippines, 2020, which was the first year of the pandemic, infant mortality or infant deaths per 1,000 live births went to its lowest level that I have record for. So it fell to a very, very low level. Now, in 2020, I think that some of that is because of lack of registration of births, because people were under lockdown condition and they didn't have a chance to register their child's birth. But then in the next few years, everything went back to normal, but we still see rising infant mortality. And the very concerning part is that infant mortality has continued to rise since from 2020 to 2024. The infant mortality is rising every year, and infant mortality in the Philippines in 2024 is the highest it's been in 23 years, meaning that something has gone catastrophically wrong with the health of infants and their mothers. I also saw Malaysia. Malaysia in 2020, there was nothing to see. But in 2021, there was a massive spike in maternal mortality, meaning that a lot of mothers died during pregnancy or during delivery. And that was an unprecedented pattern that only happened after the rollout of the COVID vaccines.
So I guess one objection would be that just because something coincides with the rollout of the vaccines, it doesn't mean that it's caused by that. What do you think about that?
Coincidence, not causality. But when you look at it in detail and you can't see any other factors that could have caused what you're seeing, you need to look very closely. And there's a lot of researchers that have looked at the mechanisms of harm. So we know that the COVID-19 vaccines are injected. They make your body generate spike protein. Those spike proteins happen to be pathogenic. So we know that there's a mechanism of harm. So how can we deny causality when we can see exactly the timing? We can't see any other contributing factors, and we have mechanisms of harm, and we see the harm escalates with every dose of COVID vaccine. So you have a dose-dependent effect. And if you want to look at the Bradford Hill criteria for causality, they're abundantly met by what we see with the COVID vaccines.
I know in Sweden, some researchers claim that, during lockdown, people stayed at home, they didn't have so much sex, so that's why there were less babies being born later.
Actually, the opposite should be true. So let's be logical. The first year of the pandemic under lockdown, you're stuck at home with your spouse. Assuming you can still stand each other when you're under lockdown, what are you going to do when you're bored? You're going to have sex. So in Australia, 2021 had their peak births for many years because lockdown at home, come on, get friendly. But then the big drop in births in many countries came from 2022, which if you consider the rollout of the vaccines, general population rollout in most countries was by mid-2021. Administration to pregnant women and women of childbearing age, low-risk healthy people, was also middle of 2021 to the end of 2021. Pregnancy takes 9 months. You would not expect to see the implications or outfall from the vaccine until 2022. Maybe I can show my Australian slides because it's quite revealing. Okay, so I'm just going to flip down to the Australian vital statistics. This is updated up until November of last year. There's no release of any data that's later. So I'd like to show here, I think you can see my mouse. So this is 2020, the pandemic. The blue is births in Australia. You see the births are generally going up. And then you see the deaths are also generally going up. 2020, pandemic year. Deaths in 2020 went down in Australia. So we see a drop in deaths. And in terms of births, 2020, we see a rise in births in 2021, meaning that people got cozy during the pandemic and they had their babies in 2021. But the vaccines were rolled out in 2021 from February in Australia. The initial rollout was pretty slow. People were skeptical. They didn't want to take them. Australia's deaths rose in 2021, but not so big. But 2022, we see a very big spike in deaths, and we start seeing a big fall off in births. So I'll show you the next slide. So this slide is showing our deaths over time. These are weekly deaths in Australia from 2019. You see there's a normal spike and a drop. So in every country that we look at, deaths are always higher at the end of winter. So in Europe, your deaths will be highest December, January, February. And in Australia, which is the southern hemisphere, their deaths are highest July and August, which is their coldest months. So the first 2 years, 2019, 2020, normal years, normal pattern. 2021, they started COVID-19 vaccination, and we see that there is a rise in deaths. Okay, the third dose was rolled out at the end of 2021. Suddenly, we see a much larger spike in deaths. And then they were also pushing this on the entire population, so the uptake was slow for the third dose, but we see deaths go to an unprecedented level. And with the fourth dose, there's an even higher rise in deaths. So if we look at our deaths prior to the vaccine rollout, our deaths are down here around 3,000, 3,500 deaths per week. And suddenly post-pandemic, now we're looking, 3,700, 3,800. And notice that the spikes in deaths are really very, very high. And the spikes are increasing over time. So what this would indicate is that the population is getting more unhealthy over time. So in a normal scenario, when you have a bad flu, a lot of people will die from the flu. But the people who died were people who were going to die soon anyway. They were already sick. But after they're dead, there's no one left to die. So following the flu epidemic, we should see a drop in deaths because there's no one who's vulnerable anymore. But following this pandemic and the vaccine rollout, we never see a drop in deaths, meaning that something has happened to make the population increasingly unhealthy. So this is very, very disturbing data. And it shows, I see this same pattern across every country that I've looked at so far, with a step change in deaths up and a step drop in births. So I'll show you the next slide. This one is male by age. And what we could see is that the youngest people, this bottom line is 0 to 44, and then it goes up in age 45 to 64 up to the seniors. What we see is that this is vaccine rollout here. And what we see is as the vaccine rollout, we start seeing spikes in deaths. We see deaths rising across all of the people age 45 and above. And particularly we see our senior citizens dying. And they die at massively excessive numbers compared to what they were dying before the vaccines were rolled out. And senior citizens in Australia are still being very strongly encouraged to get COVID vaccines every year. So this is for the men, and this is for the women. And we see the same pattern with rising deaths across all except the youngest age group. But even the young women have slightly gone up, but it's not a large number. But massive rises in deaths of our senior citizens. So this shows a really catastrophic population health outcome.
I would like also to, because I asked you about women being especially hit by this, and there was a quote that really stood out in your article. I just want to read it. You say, between 2015 and 2020, there was 74 to 75 female deaths for every 100 male deaths. This pattern of more male death than female reflects the longer lifespan of women and overall increasing population longevity. Female death rose in 2021 with 79 female deaths for every male death. At least for me as a layman, it sounds like an incredible change.
Yes, so what this means is whatever is causing the deaths is more dangerous to women than it is to men. So women are increasingly unwell. And in the Australian data, I could see that the older women were dying at higher rates than the older men.
And why do you think that is? Is it because the side effects, the adverse events seem to trigger things that are typically female, like I know we have talked about before in my programs, like irregular menstruation, excess bleeding, miscarriages. Why do you think that women are especially hit?
Well, we know that there's gender differences in how people respond to drugs. So we also know that the COVID vaccines have they tend to concentrate in ovaries and reproductive organs. So for sure, females are affected by that. I also think it's because these vaccines cause accelerated aging, and they cause acceleration of any underlying health conditions. So in the past, women tend to live longer than men, and they tend to be healthier for longer. But with the women taking these vaccines, I think their ill health has been accelerated. And many countries are still claiming increases in life expectancy. But I suspect that the increases in life expectancy that they're reporting in current years are based on models rather than actual figures of what's happening in the population. Because with so many elderly people dying now, and the increases in deaths among younger people, how can life expectancy be increasing? I'll show you another slide, which you might find very interesting. This is deaths in Malaysia by age. So it goes from 0 to 4 up to 85 plus. And it's from 2019 up to 2024. So it's by year deaths. So here is, the blue is 2021. And we see deaths rising in all age groups from 15 and above. It's gone up there. The youngest children didn't go up. They didn't get vaccines yet. But we see even amongst, people, young people, 25 to 29, 35 to 39, massive increases in deaths. And although the deaths in the younger people seem to have come down, it is still a step higher than the deaths that we were seeing prior to the vaccine rollout. And the deaths in the middle-aged people are considerably higher than this, just catastrophic. And then the senior citizens, they've been devastated. And I have exactly the same data for the Philippines. I can show you the Philippines. This is the Philippines, similar data, looking at the by age death. And we see, in the Philippines, we see a big rise in deaths in the infants. Lowest still in 2020, the blue is 2021 and rising over time, but we see deaths across all of the other age groups. The elderly people, 85 and over, they died at 62% excess in 2021. So instead of 100 old people dying, as per usual, 162 people died in 2021. So we were locked down and we were vaccinated to protect our grandparents, and instead we killed them. This is not due to poverty. This is not due to Philippines has good family support. Of course, there was increased poverty, but this sort of death pattern cannot be explained by anything except external factors. It is completely abnormal and atypical. Yeah, I feel very upset when I look at this data.
Yeah, this is heartbreaking, really, to see. And as you say, this whole thing was the promise to protect the elderly.
Yes, to protect the elderly. You vaccinate the children and the young people to protect the elderly. You vaccinated the people who were not at risk from COVID because they were people whose immune system could handle it just fine. And then you harmed them, and you also harmed the grandparents and killed them.
So this excess death, what did they die from?
Okay, so in many countries, they claim that the excess deaths were due to COVID-19. However, when we break down the deaths, we can see that the deaths are far higher than could just be explained by COVID-19. And we also have to remember that, at least in the Philippines and many other countries, no matter what you died from, if you tested positive for COVID on a PCR test, or even if they wanted to assume you had COVID, then your death was counted as a COVID death, regardless of what your underlying cause was. So, we really know that the only people who really died from COVID were those who were already very sick from something else. Everybody else who died probably shouldn't have died from COVID. I had an experience in the Philippines. I worked on a construction site, and there was a person, not my subcontractor, there was a person who died in an industrial accident. He went into a pipe and he suffocated and died. His body was taken to the hospital. They declared him a COVID death and refused to release the body. And the company whose contractor he was had to sue the hospital to get his body released and to change the death certificate not to show COVID. So yeah, there was a lot of falsification of COVID cause of death. Okay, so even assuming their cause of death as COVID was correct, which we know it wasn't, there were 6 times more deaths in the Philippines, 6 times more deaths than could be explained by COVID. So something else was causing people to die in excess. And I saw the same in Malaysia data. In other countries, I'm sure had the same. The deaths were far more.
So one thing I discovered when I have been working as a reporter on this is like it's very hard to say exactly how somebody is going to be affected. But for instance, I interviewed people who had multiple sclerosis, and they had their disease under control for many years. Then they take the vaccine, and it just starts, speeding up. Same thing. Cancer, maybe somebody has a cancer and have it under control, they take the shot and it just goes crazy. So it almost seems like this vaccine finds your Achilles heel where you have your weakness. And then I just want to get your take. What tendencies have you seen?
Yeah, I absolutely agree with you. I have had the opportunity to work with some doctors here in the Philippines, also in the US, and I'm in touch with doctors in Australia. And what we see is that these vaccines cause immune destruction. They cause immune destruction by multiple mechanisms. We have both the harm from the lipid nanoparticle and we have the harm from the spike protein. It causes the immune system to collapse, which means that people become much more susceptible to all sorts of other infections and illnesses. It also causes autoimmunity because the spike protein is being generated by your body's own cells. So your body will recognize the spike protein on your cell as being abnormal. But when it reacts, it will also recognize your own cell as being abnormal. So if your thyroid was generating spike protein, your immune system will go, oh, spike on the thyroid. I attack that cell. Now they're creating antibodies, not just to the spike protein, but also to your thyroid. So now you have thyroid failure. Now you have diabetes. Now you have a whole range of other autoimmune conditions. So the harm from this comes from many directions. We are seeing, I'm seeing an escalation of deaths again in 2025-26. I'm seeing deaths arising. And particularly this year, I've lost several close friends recently from cancer. People in their 40s, in their 50s, only diagnosed post-COVID vaccine. This is not normal.
That was going to be my next question. What about cancer patterns?
Yeah, cancer, in terms of the vital statistics, I'm only seeing a slight rise in the Philippines data, but I only have the data for the Philippines for cancer up to 2024. But there is an increase, and there's an increase across all age groups. Particularly notable would be people in, I saw a big spike in cancer in people in their 70s. I haven't published an article on this yet. I will be doing so in the next few weeks, or maybe the next week, because I'm looking at the causes of death. And we see big changes in death patterns. We see changes in infections. We see changes in cancers. We see changes in autoimmune diseases. In the Philippines, there's been a very big spike in deaths from connective tissue disorders. This would be autoimmune related conditions. So yeah, the cancers, everything, all of the causes of death are increasing now. And COVID deaths are not. COVID deaths in the Philippines are very low now. In the Philippines, about 78% of the population was vaccinated, primary series. We had 6 or 7 different vaccines available here. Pfizer and Moderna were very popular, particularly Pfizer, and then we had the Chinese vaccines were popular. But we had everything here. But only 20% of the population took 2 or 3 or more doses. So we don't have a population that's taken multiple doses. And we don't see active circulating COVID in the population. It's surely still here, but we're not hearing about it the way we hear in Australia or other places where they keep having waves of COVID.
And do you have any idea which vaccine was more harmful? Was it Moderna or Pfizer or Johnson & Johnson?
I think it's batch specific. We know that every brand of vaccine has certain batches which are known as death batches. In the Philippines, the most toxic vaccines were Johnson & Johnson, Janssen vaccines. When the Janssen vaccines were rolled out, I saw a massive spike in deaths in the Philippines. Not just excess deaths, I call it hyper excess deaths. Very catastrophic. We had a family of 4. They all got vaccinated with Janssen and they all died within a few days of each other. And the authorities investigated that and said that it was natural causes, not related to the vaccination. And that was the standard response in many countries, regardless of how soon after being injected you died. It was always something else, not the vaccine.
And one factor which has been also discussed in the alternative media is the rollout of 5G, which also pretty much coincides with the vaccine rollouts and the whole talk about COVID-19. Do you have any ideas if that could be also a factor in this?
I think it is certainly a factor. We know that humans are energetic beings. We know that our bodies respond to EMF. When we bring in 5G and continuous exposure to EMF, Wi-Fi and other signals, we know it has physiological impacts. There is also a type of they call it soft physics. It's actually looking at how matter responds to EMF and other signals. And there are people who are doing research into this and can see that there are components in vaccines, in medicines that respond to EMF signals. So if we can see this under a microscope, and we know that there was all of the discussion about people being able to get a code on your phone to see someone has been vaccinated. So we know that there is an interaction between the vaccine components and components in medicine and food and other things that respond to EMF. And there is a lot of research which is not mainstream acknowledged, showing that EMF causes harm to human beings. And I personally believe that the vaccines and other medical products that are responsive to EMF are accelerating the harm.
Just very interesting to have also somebody on from the Philippines. I don't think we had that on. Can you tell us a bit about the atmosphere in the Philippines? Like, is it, or people openly talk about these side effects, or are you being called like an anti-vaxxer or conspiracy theorist when you discuss this?
Okay, the mainstream media is very much talking about anti-vaxxers and conspiracy theorists. Nobody is talking in the media what happened during the pandemic. It's as if it never happened and never existed. We did have an inquiry into excess deaths in the Philippines. That was from late 2022 into early 2024. And we had 6 hearings with the Philippines Congress, and then it was adjourned with no conclusions. And there's been no word about that since. So mainstream and officially, no conversations. If you go and talk to people on the street and regular people, they are very aware. Many people are aware that there were problems and that people have been harmed. I mean, for me, because I know so many people in this movement, it's a little bit like an echo chamber. There are still other people who deny harm. So I think it's a mixed bag. People just, I think in general, they just don't want to know. And, people think, oh, there's so many people having cancer. Well, maybe they didn't eat the right food. Maybe it's their lifestyle. So there's a perception that the vaccines were fine, officially. But yeah, I think we have to build the grassroots understanding of the situation. But on social media, when there's a post talking about someone's died, all of the comments are saying, was this person vaccinated? What happened to them? Because people are putting 2 and 2 together at a grassroots level.
And isn't it also like very human to, I mean, you don't really want to take on board that maybe I have this now inside my body and this is can do so much damage. For instance, you mentioned that you had friends who died from cancer. Did they acknowledge that it could be linked to the vaccine, or were they like in denial?
No, my very close friend who recently died, he died last week, he was a very close friend, and I asked all my close friends, I said, you need to be aware that these vaccines may not be safe and you should not take them. He took Moderna anyway, and he developed cancer about a year later. He was fully aware that it was from that, yeah. But not everybody is, but he was. We have doctors in the Philippines who try to give, I guess, holistic care for people with cancer. Some of the well-known doctors here, they combine conventional and holistic approaches as far as they can. But cancer treatment in the Philippines is enough to bankrupt a family. You can go from middle class to poor due to cancer treatment or any other serious medical illness here. We don't have a good social support or medical a safety net for people who have poor health. Even prior to the pandemic, I personally knew women who died of cancer with no treatment. They couldn't afford treatment, so they never got treated. They just died untreated. So that situation did exist before. And the government, to be fair, the government is trying to address this. It's not being ignored, but adequate, comprehensive healthcare is out of the reach of many in the Philippines.
So in the communities where you are active and you discuss adverse events and so on, if you just zoom out from all of this, what is the general take? What was this all about?
Well, you can step back as far as you like. Club of Rome, global agendas. Then we have the Epstein files release, and we see Bill Gates and Epstein collaborating for pandemic planning and pandemic industry. So I think this is, power and control. We look at the World Economic Forum and the WHO and all of these organizations, and there is indeed a globalist agenda. And this is part of the globalist agenda, seeing how far they could push control of the population, how receptive the population is just to doing what they're told without question. So I think this is part of a much bigger agenda.
Because then really the whole notion of a side effect is really a misnomer. Then it was actually the effect they wanted.
I think this is a way of, we know the intent is to reduce the global population. We also know that the intent is you will have nothing and you will be happy. The best way to transfer wealth from population is through healthcare. Because when you get sick, you are desperate for anything to get better and to survive. So I think this is reduce the population, transfer wealth. It's part of the agenda.
But most healthcare workers and doctors, they didn't know anything about this agenda.
No, they didn't know. You could say they were pawns. But on the other hand, if you're a medical professional and you've been trained in clinical science and problem solving, at some point, I think we have to say, you should have seen there was something wrong. This is within your professional expertise. You as a doctor, you as a health professional, you as a health minister, you should be analyzing data. You should be seeing what happens to your patients and putting two and two together and using your clinical skills. And it seems as if judgment completely went out the window. And, we can say, yes, it was a PSYOP. There was a very intense PSYOP, intensely in 2020, but even prior to that, we look at the movies we watch, predictive programming, we look at our education system. Does it train us to follow instructions, or does it allow us to question? So I think getting to where we got in 2020 and 2021 was something that had been in process for decades. Yeah, and I think when you're a professional, not knowing doesn't cut it, because you as a professional should have had the skills to see there was something wrong. In the Philippines, our FDA, they said, we will not evaluate the vaccines because we will refer to the expertise of mature regulatory agencies. So it was referring to European, Australian, US regulatory agencies, and said, if they approve it, we will approve it. Sorry, where is your responsibility?
So before we wrap up, what are your thoughts? Are people slowly waking up to the reality of what happened, or is there increasing denial?
I think there is increasing awareness. I think there's definitely increasing awareness. I think that the platforms like X and, not mainstream media, but non-mainstream media are very much talking about this. I think what is coming out with, the release of the Epstein documents and a massive research is reaching a critical point that it's going to be undeniable. So I think we are moving in the right direction. And for those of us who knew what happened, we have to understand we've had years to be where we are today. If you're a person who's always trusted the medical system, trusted your doctors, trusted the authorities to take care of you, and you find this out all of a sudden, this is a complete shift in your perspective, which is a huge shock. So I think we have to have a lot of empathy for people who are just becoming aware now of something that, we've known now for quite a few years, and we keep growing that knowledge. So I think it's it's growing. growing awareness. It's unavoidable. It's in our faces. And I think the best way to bring attention is to remind people how things were before. Children didn't die of heart attacks before. It was vanishingly rare for a child to have a heart attack. Now they have, they have resuscitation equipment in every school. That's not a normal thing. We didn't used to have athletes collapsing on the field. We didn't used to have our media full of actors who died from cancer. So I think we have to remember the past, see what we have now so that we can see the context of what we're dealing with.
Sally Clark, I want to thank you so much for being on the program.
Yes, thank you very much.